Hi everyone, today we'll be discussing about periventricular leukomalacia. Here we have a cross section of the brain where you can see these are the ventricles. Here we have caudate nucleus, globus pallidus, putamen. You have a middle cerebral artery with long penetrating arteries and short penetrating arteries. Here we have to remember this area in the periventricular region is more prone to leukomalacia. Why this area is involved? Because in the patients, especially kids with preterm, less birth weight like less than 1 kg, 32 weeks, for them there is inadequate perfusion of this area due to inadequate perfusion of the long penetrating arteries. There is no perfusion, there is no blood, there is no oxygen, the cells die and they go into necrosis and then cyst formation. So first, there are 4 grades of leukomalacia. So when you get this question, just draw one small diagram and start writing the grades. In grade 1, there will be areas of increased periventricular echogenicity without any cyst formation persisting for more than 7 days. So first there will be periventricular echogenicity. Cyst will not be there. Why we have to see for more than 7 days? Because even preterm babies, normal babies also have periventricular flare. It persists for less than 7 days. So when you do a scan on a preterm baby, you see a periventricular echogenicity. Again you do a scan after 7 days. If this persists for more than 7 days, then it will be in grade 1 periventricular leukomalacia. Coming to grade 2, this echogenicity has resolved and they form a small cyst. In grade 3, areas of increased periventricular echogenicity. In the areas of increased periventricular echogenicity, they develop into extensive periventricular cyst, mainly in the occipital and frontoparietal region. Then coming to, we have grade 4. These are areas of increased periventricular echogenicity in the deep white matter developing into extensive subcortical cyst. These areas, they extend up to the subcortical region where there are subcortical cyst formation. Normally, babies who are preterm infants, they are more prone. Prematurity and low birth weight is one of the risk factors, like less than 1.5 kg. This is a white matter disease that affects the periventricular zone. So coming in premature babies, the periventricular zone is a watershed zone between deep and superficial vessels. The periventricular white area, the high risk for ischemic insult, because at 28 to 34 weeks, the maturation of the centrifugal arteries is not complete. So during this period, when the baby is born, that area, there is a periventricular region, there is a periventricular white area which has a high risk of ischemic insult because the maturation of the centrifugal arteries is not complete and the vascular supply to the periventricular area is tenacious. Then coming to and the vascular supply to this area, in this period, it depends solely on the medullary arteries coming from the cortical surface. With progressive maturity, the watershed areas move to the cortical and subcortical zones of the brain. Then in what are the areas which are involved? They are dorsal and lateral to the lateral ventricular area is involved, involving the centrum semioval, the optic, that is the trigone and occipital horns, and acoustic radiation. These are the areas which are involved. So which of the areas are mostly involved in periventricular leukomalacia? Dorsal and lateral to the lateral ventricular area is involved. That is the area where there is centrum semioval, the optic and acoustic radiation. The optic is trigone and occipital horns, acoustic is temporal horns. These are the areas which are involved. Then first there will be periventricular white matter. Blood flow will not be less, there is no oxygen. The cells which are present in the white matter area, it dies and then forms a necrosis, then cyst formation, then parenchymal loss and enlargement of the ventricles. Periventricular gliosis will be there, demyelination will be there, loss of periventricular white matter. So first the blood flow will be less, then oxygen will be not there, then the cells die, they go into necrosis, then cyst formation, parenchymal loss will be there, with surrounding ventricle enlargement will be there. So mainly centrum semioval, these areas, the periventricular white matter, pyramidal tracts and optic radiation are involved. Due to this, there is cerebral palsy and decreased visual acuity. See this area. This is the periventricular zone. This is the periventricular zone. Here you can see this area is the leg area, trunk, arm, face and mouth. So why cerebral palsy? Why is there is quadriplegia, why there is diplegia, why there is hemiplegia? Because the fibers which go to this leg, trunk, arm, and they pass to the periventricular region. So when this area is involved, the cells in this area are damaged. Obviously, the motor area, we have quadriplegia. Depending upon the amount of area involved, we can have quadriplegia, diplegia, or hemiplegia. As you know, this PVL is the area of increased periventricular echo density. Normally, the echo density of periventricular white matter should be less than the echo density of the choroid plexus. Normally, if there is an echo density, this echo density should be less than that of choroid plexus. But in grade 1 of PVL, the echo density is asymmetric, coarse, globular, and more hyperechoic than choroid plexus. Remember, normally in preterm babies, there will be a periventricular flare. Their echo density normally will be less than that of choroid plexus. In grade 1, this echo density is more than that of choroid plexus. It is coarse, globular, and asymmetric. The abnormal periventricular echo texture of PVL disappears at 2 to 3 weeks. This grade 1 disappears at 2 to 3 weeks. So, the periventricular flare which we see in the first week of baby, again we have to do a scan after 1 week. So, flare persisting beyond first week of life is PVL grade 1. In grade 2, grade 3, grade 4, the cyst located bilaterally in the parieto-occipital region. So, location of the cyst, it tells about the risk. If they are located in the parieto-occipital region, located bilaterally, there is increased risk of cerebral palsy. Solely anteriorly located cyst, normal outcome. Increase in size of the cyst also have increased risk of cerebral palsy, like more than 2 centimeter cyst. As I told, flare. Slightly echogenic periventricular zone seen in many premature infants in the first week of life. Flaring persisting beyond first week of life is by definition PVL grade 1. So follow-up scan is important in this people. I hope everyone understood. Anything is there, you can message me. Thank you.